At the end of July will mark 52 years since the enactment of Medicaid and Medicare. President Lyndon Baines Johnson pushed hard for their adoption and signed them into law in Independence, Missouri, the hometown of President Harry Truman. Truman was there that day and became the first Medicare enrollee. Medicare provides hospital and medical insurance for people who are over the age of 65. Medicaid is not based on age, and it gives medical insurance to people who are receiving federal assistance. Under Medicaid, states can opt in or opt out, and participating states receive federal matching grants to help cover health costs of residents. Today, Medicaid covers about 70 million Americans, 20% of the population, including 40 million children and 2/3 of the people who live in nursing homes. The Affordable Care Act, Obamacare, gave states the opportunity to expand Medicaid coverage to low-income residents, and many did, 31 states, in fact. Though much of the debate has focused on baby boomers, actually, data shows us it's millennials who could be disproportionately impacted by the Senate's new proposed legislation. Jen Mishery is the executive director of Young Invincibles, a group focused on millennials and healthcare. It's nice to have you.
Thanks so much for having me.
My pleasure. So you call your organization the Young Invincibles. Explain the name to me.
Sure. So it's a tongue-in-cheek name. It takes the concept that was rolling around during the original debate around the Affordable Care Act, what we think is a myth, that young people don't really care about health care, they don't care about health insurance, when in fact we found, poll after poll has found that young people actually do care about health care. They're interested in ways to get covered and access services they need.
As you assess the Senate's version of the health care bill, what's your takeaway?
You know, we're really concerned. Today, the youth uninsurance rate is at about 16%. And we've actually done some research to show that if all states expanded their Medicaid programs, which they're allowed to do under the ACA, that number would actually drop again to 9%. So we've seen huge gains in coverage over the last few years. But what these proposals we're seeing coming out from Senate Republicans, from House Republicans, will do a lot of damage to the kinds of coverage provisions that young people have actually relied on since the passage of the ACA.
Millennials are the population that is struggling with college debt more than any other group. Is this part of your concern around healthcare debt on top of college debt?
So when we're talking about student debt, when we're talking about lower wages, and then you add medical debt into the conversation, you're really talking about a lot of financial volatility. And so when we're talking about the kinds of challenges that a young person might face when they're uninsured, medical debt and medical bills are a huge question. About half of uninsured young people, this was a pre-ACA study, actually struggled to pay for medical debt and medical bills. And so when you're saying, you know, people think, well, young people they don't need health care, they're not accessing the system. That's just not true. They are accessing the system. And in fact, half of uninsured young people were struggling to pay for the services that they were accessing.
What's the impact potentially of cutting those 10 essential services, the list of those 10 things that you are guaranteed under the ACA for millennials?
When you look at the kinds of health care needs young people have, you also have about 30 million young people who have a pre-existing condition. And actually need those healthcare services, and it becomes harder to access them under some of these proposals.
The new bill would also, in theory, penalize people if they didn't have healthcare coverage for, I think it's 63 days. You could theoretically be bumped off of healthcare for 6 months. That, I would imagine, is a bigger problem for millennials who seem to go in and out of jobs early on in their careers more than somebody maybe who's middle-aged.
And that's exactly right. So this makes sense. Young people are moving around, trying to go to school, and so they are more likely to see those gaps in coverage. We estimate that about 1/3 of young people see a gap in coverage over the course of a year.
So when I spoke to Senator Cassidy last week, you know, his answer to everything was kind of like, listen, we can't afford it. You say if we were able to expand Medicaid, we'd be able to drop the number of uninsured to 9%, which would be a historic low. How do you suggest paying for something like that?
Do we want a system and a social safety net that provides access to health care for low-income people when they need it, and provides a system that is more accessible, not less accessible? I think most young people would agree that that's the kind of investment they want to see.
Jen, thanks so much for being with us.
Thank you.
You bet.